cancer after 2 years already.
Okay.
So I went every year because feeling myself, I did not feel sure enough.
Yeah.
So well, she thought, she thought I had a dimple in my breast, and I did not know that I would have had to look to a dimple in my breast. So.
Wow.
And that it appeared to be a big tumor. So, yeah.
So, Riet, how would a common woman, a common a lay woman, identify what are how are they supposed to check themselves for this?
Yeah.
Because you know, I came from a medical home, so maybe you're watching me always doing this and trying to touch it, because my mom told us that you can always touch your breast all the time. My sister as well, and also my brother. So from a medical home I came, so I'm pretty aware of how to check myself a little bit at the breast side to observe some signs. But what other things can we look out for?
Well, first of all, you must know how your body feels and how your body is. You must know yourself the best.
Okay.
And then you can mark the changes. Changes, signs which can be probably a breast cancer, are you feel a lump, which you never felt before.
Yeah.
Or you feel a dimple, like Lydia said, or you feel, sometimes you feel very little pains, like some very thin needles in your breast.
Oh.
That's also a sign.
Okay.
But also your the skin of your breast can be a little bit red, especially in a part of your breast. The breast can have another form. One breast can feel a little bit heavier. So there are more signs which you can mark, and when you see a change in your own breast, in one of your breasts, or both, then you need to go to the general practitioners, the family doctor, and ask if he or she can also feel with you and make a decision to go to an hospital. And then, of course, it is very essential to go to a hospital where they have a so-called Mama Polyclinic. Mama Polyclinic is an outdoor clinic in a hospital in which a multidisciplinary team, so all the doctors who work with breast cancer are together in one team, and that is a diagnostic radiologist, that is a diagnostic radiographer, a surgeon specialized in breast cancer, a medical oncologist specialized in breast cancer, also the plastic surgery, the pathologist, etc. And in that Mama Poly, when you come there for the first time, then you get all the examinations in one morning.
So hold on there. Mama Polyclinic. Is it in all the hospitals?
Yes, nowadays it is in all the hospitals. We had to advocate for it many years in the Netherlands via the Breast Cancer Society, the patients' organization, and we made we discussed everywhere in the Netherlands, and now all hospitals do have a Mama Polyclinic. There is some family doctors, some general practitioners still do send their patients only to the radiologist, and they say, well, you go to the radiologist, he will make a mammography, and then come back to me as general practitioner, and I will say what is the diagnosis based on that mammography. But that is not enough. You have to go to a Mama Polyclinic, and then you have to go through a procedure. First, the doctor, the medical doctor, the surgeon, or the nurse practitioner specialized in breast cancer will examine your breast with hands, and then you go to the radiology department. There is a mammography made. If necessary, an ultrasound echography is done. After that, when they see something in the echography or the ultrasound image, then they make a punction or a biopsy, and then they send you back to the multidisciplinary team. During the lunchtime, the team is coming together, and all patients who did come in the morning, they went to, they are discussed in that team. So all the doctors are looking at all the images and looking at what they are thinking, and then afterwards they say, this lady has a breast cancer, this lady has no breast cancer, and this, well, also some men do have breast cancer. It's only a few parts in the Netherlands, only 100 per year male breast cancer.
Really?
But then after that, all the patients of the morning who went through this procedure, they will get the diagnosis, and they will get a plan, a treatment plan, and then a discussion also with the mama care nurse, and after that, then everything is starting in the hospital. So that's a nice one-stop, one-shop morning, and you will have all the results.
Wow. Well, we are broadcasting to the migrant community, and I would like, Ebon, can you say something? Is there any way you can describe a little bit, again, the symptoms that they have to look at in our own way?
Well, thank you very much. One thing that I think is on the line and is very important, especially from what Nikki said, is the history. The history of breast cancer in the family. And sometimes the mother, the sister, an aunt, it's something that we need to pay attention to. And then, of course, like Riet said, all the signs that could be there. Usually, a breast lump in breast cancer is painless. That is, if there is a lump, it's a painless lump. So many times we say when the lump is painless and cyclical, it might just be hormonal. But when it's a lump that you have noticed and it's something that wasn't there before, then you need to pay attention. Don't just wish it away. Look at it. Go to the house, go to the GP. Pay attention to all the symptoms that you might have.
But those are the things I want to hear, because she said not only lump, she also made mention of
dimple. Yeah. Sometimes you have a dimple. Yes. Sometimes you have a dimple. But, or burning sensation. Well, and sometimes it's red, but I guess on the African skin, it might not come like that. But the most important thing is that you notice a difference in the size and in the shape of the breast.
It begins to increase, right?
Not necessarily increase. The key is that you know yourself. And I think you said that earlier on about just observing yourself. Sometimes,
no, what do you mean by it? I want to understand that, because many people out there listening to us right now, even some of them may be afraid to call in because maybe they cannot really speak properly. All right. So let's relate to those people on that level, because that's what Voice of Nigeria is standing for. Making information available to those who are the grassroots, who wouldn't be able to use all these medical terms we are using here. So what I want to know, you said increase in breast, know your breast. How would they know their breast? Because it's like you are saying that the breast becomes swell. Does it become heavy? Because I saw somebody who had cancer one time ago and the breast was very big. How about that?
Well, sometimes I guess it depends on the stage of the cancer. But what I tell people, women out there, what I'll say to you this morning is observe your body. It's not just about the breast. Get familiar with yourself. Sometimes you look at your face in the mirror and, instinct, you just feel something is wrong. Oh, this eye looks different. That's what I mean by that. And I remember the last time I gave this talk at the Nigerian embassy, one of the men actually said that he is the one that observes, as a husband, that observes first differences in his wife's body.
But the point is, whether it's the wife or the husband or with the child or somebody, just, you know, pay attention. We should pay attention. We should move away from this mindset that you don't, you know, that you don't know yourself, you don't touch your breast. It's your breast.
Yes.
So you have a responsibility to look at it. Yes. And when there are changes going on,